It's 13 after 7, this Sunday edition of the South African Morning. Good to be with you. I'm Gareth Edwards. Marcel Gordon is away for this weekend. Now, with the pandemic seeing more and more hospital admissions, there are still, listen to this, still 284 unplaced doctors on the health department system. Now, the department says it is aware of this, so why are they not on the front line in helping against COVID-19? The health department's workforce management director, it's Mr. Victor Khanyile joining us. Mr. Khanyile, good morning to you. Why haven't we put these unemployed doctors to work? Hashtag unemployed doctors in SA say they want to work, they're waiting for a phone call, but you haven't phoned them yet.
A very good morning, Gareth. Indeed, we have, and I quote, in terms of our internship and community service placement program, the 288 medical students who just qualified between the period March to date in around the last month of May. Now they are waiting to be allocated as medical interns starting from the 1st of July 2021. Just to give a context on the matter, in terms of our regulations and also our guidelines, we allocate medical interns to commence duty on the 1st of January of each year and also on the 1st of July of each year. So as much as they have now completed and met all the eligibility and requirements of them being appointed, they indeed have to start or commence duty on the 1st of July.
Okay, so one step forward, as far as the 1st of July, they will be in the workforce. There are still going to be those unemployed doctors. Victor, I'm sure you would have seen this yourself, saying, but even though there is 2 intakes a year, they could have been functioning from February, March, April, May, June, and so on and so forth. Why was there a decision made to still stick to the biannual intake? Surely in COVID-19, a rule like that could have been forced to step aside.
Gareth, it's quite important to note that the appointment cycles, particularly for medical interns, are based on 2 important issues. The first one is the fact that medical interns are appointed on training posts. Those posts are rotated in terms of the Health Professions Council of South Africa on a particular domain period. And they have what we call supervisors as well as specialists that ensures that they complete that particular domain in that period. And again, that's the first part. The second part is the fact that it's replacement posts. So you have a 2-year cycle appointment where people start 1st of January. For the 2 years, the end of December, then you can start with a new cohort of employees on the 1st. Similarly, you have to start appointments as those that are exiting or vacating the positions, which is inherently a period of 1st January and 1st July.
So now we're going to have these new doctors coming in. As you say, the Medical Health Professions Council is also a part of this. As of the 1st of July, how are we going to be allocating these currently unemployed, soon to be employed, you tell me, doctors? How is that allocation going to be determined, considering what's happening in Gauteng and considering how overwhelmed the hospitals are?
Yes, indeed. As already mentioned, that what we are intending to do as we are finalizing the allocations, and I have to put in record that there is a meeting happening on Tuesday with heads of health departments from all 9 provinces and the Director General of the National Department of Health, where we will be presenting the total number of available medical interns. And as we sit, we do have 213 accredited posts over and above the 118 that we already have, where we are trying to get provinces like Gauteng, where there are more challenges, to take more medical interns. So that discussion will be happening in the week, and obviously it is a discussion that also includes availability of funding.
So out of the 288 unemployed doctors that we're reporting on at the moment, you're telling me, Victor, that come the 1st of July, 213 of them are ready to go. Is that what you're telling me?
In terms of our records, the current funded posts, which have been confirmed by the provinces, it's 118. Those are current funded and accredited available posts. And now I just put on record that we do have an additional of 213 posts, which are accredited and unfortunately not yet funded. Hence, we're having this urgent meeting to discuss how we ensure that funding for those 213, particularly looking at areas or provinces that are more hidden, which includes Gauteng, to ensure that we unblock those funding and all these medical interns, which we are confirming that there are 288, do get positions and they start. And as I've already mentioned, I mean, that the appointment date, it's indeed the 1st of July 2021.
Okay, so that's happening the 1st of July 2021. Thank you for the clarity. What's going to happen between July and January next year? Surely, considering what we're going through as a province and as a country, we can't wait another 6 months. Why are we not, as doctors are getting the funding, as they're going through the prerequisites, why are they having to wait 6 months? Can we not get them in far before January 2022? Surely we now start thinking about these things differently.
Indeed, I think it is quite important that we look at how do we ensure that they are no, confined to periods of employment. But I need to put on record that the next cohort will only be qualifying at the end of December 2021, readily being appointed on the 1st of January 2022. I think we need not to confuse issues. There are posts of employment for medical doctors that have met all the requirements of being employed as medical doctors. Here we are talking about medical students who've just completed and are now ready to take up positions as medical interns, which is a rotated training platform that it's confined to 2 periods, which is 1st of January and 1st of July. And the other challenge is if we appoint the whole 288, obviously there wouldn't be any person who's available to take up a position before they complete and meet all the requirements of registration with HPCSA, as well as finalizing their last exam with the institutions of higher learning. So the next intake will be on 1st of January 2022.
All right, seems like quite a process, but it sounds like at least there's going to be a discussion around trying to get doctors in quicker than 2 times a year. For the moment, I'm going to say thank you very much. Health Department Workforce Management Director Victor Khanyile. If any of those unemployed doctors are watching, it does sound like it's quite a complicated process. There's a lot of red tape involved. You're welcome to tweet at eNCA. Tell me what you thought of that conversation, if it made any sense to you at all. You're also welcome to tweet me, Gareth Edwards, SA. I'd love to hear from the unemployed doctors. Did that make sense? Does that work? Is that how it happens on the ground? I'd love to hear from you.